Welcome, everyone. We'll get started here in just a second. I guess it's still good morning. In a minute here, it'll be good afternoon. Well, it's straight up noon, but we don't have anybody in the waiting room, so I think we'll just go ahead and get started since we're shorter today. Welcome, everybody, to our first Capital Chat of 2025. For those that don't know me, I'm Brooke Lovelace, Executive Director of the Iowa Developmental Disabilities Council. We're excited that you're here today for at the end of the first week of session. You may have noticed, but we are doing these more frequently throughout session, but at a shorter time. So they'll be about every other week for 30 minutes. So you can get your information a little bit more timely, but then you won't have to stick around with us for a full hour. So we'll see how this goes, and hopefully you guys like it. With that, I'm going to go ahead and turn it over to Amy, who's going to kick us off today.
Thanks, Brooke. Oh, I'm clicking too much stuff. I'm Amy Campbell, and I was going to just quickly today go over a couple of the things that happened this week. First week of session, not a lot of bills introduced, but not a lot of meetings and action actually happened. The biggest issue this week was the governor's presentation of her priorities and her budget. And so we wanted to review those first and then talk a little bit about a couple bills that have been introduced. And then Carlin's going to wrap it up with some ideas of what you might do if there's something here that you want to take action on. So I'm going to talk about the governor's budget. I'm going to flip forward just for a second to show you some charts, because I think it's a little easier to see pictures. And so I just wanted to mention that the governor's budget is just about $9 billion. So, but a lot of her increase, she's increasing the budget this year by a half a billion dollars. So that's $500 million. And a lot of that is going into the Medicaid budget. Now, obviously that's what we're really looking at, but I always like to show this pie chart to begin with so that people understand just where our tax dollars go. And as you can see, the majority, about 3/4 of our tax dollars, go to either education programs. So that would be both higher education as well as our K through 12 and our AEAs, or our special education division now in the Department of Education, and Health and Human Services, which includes Medicaid. When you add in corrections and the courts and prisons and other things like that, you can see that it eats up most of our budget. So when you look at a $9 billion budget, it's almost all going to education, prisons, courts, and Medicaid and other human services. I also wanted to show you that we have been increasing our Medicaid budget. This is total Medicaid expenditures. So that includes the federal dollars. And what I think is really interesting is when you include the federal dollars and you look at this, we're actually almost the same as our total state budget. When you look at that $9 billion total going into Medicaid, we have a $9 billion state budget. So it's really pretty interesting when you look at how much total dollars goes into Medicaid. When we're talking just under $2 billion for Medicaid and state dollars, when you match that, that's a lot of money. So I wanted to show that chart first before I went into the details. But the governor is recommending an increase of $223 million. That is really just to do everything we're currently doing. It's not really showing any increased access. There is nothing in the budget for waiver reform, HCBS waivers. There is a small amount, $5.6 million for provider rate increases. But really most of that is just filling in the budget for the loss of federal dollars we got during the COVID pandemic, when we had a little bit of extra money, federal funds. Actually, it was a lot of bit of extra money of federal funds coming into Medicaid. So that's just to keep everything the same. The governor did recommend that applying for a Medicaid waiver to allow the state to do work requirements. So basically requiring people receiving Medicaid to show that they are either working or going to school in order to stay eligible. We know that there will probably be some exemptions from that, so we'll have to take a look at that. But it is something I know a lot of legislators would like to do. So that is something, the details of that are something that we'll be following closely. The AEAs again take another, area education agencies again take another $32.5 million reduction. That's kind of carrying forward what happened last year. Again with their, but shifting more of those funds toward the state. They are also increasing school vouchers. So those are the education savings accounts by a significant amount of percentage to cover the need. We've been going over what our predictions were in the last 2 years. So those are for people going to private schools. I just note that because some of that factors into special education and how the services in public schools are being financed as well. But those are kind of the highlights of what the governor presented. There were a lot of details we'll probably cover in our newsletter. And certainly we'll have more information as sort of the meat gets into those proposals. I'll pause there if anybody has any questions about what the governor presented, and then I'll move on to the bills. I'll let you absorb, and then we can follow back up in the end. So there are a couple bills that we wanted to highlight. Senate File 14 by Senator Jeff Taylor, who's from up in Northwest Iowa. He has again reintroduced the Comprehensive Transition and Post-Secondary Program Scholarships. That's a mouthful. Those are the programs like REACH at the University of Iowa and Next up at Northwestern. And they provide 1 or 2 year programs for young adults with disabilities on a college campus. It's a lot of vocational training. And those are non-degreed programs, so therefore not currently eligible for other kinds of tuition scholarships. So they're quite expensive. This would set up a program that it doesn't have the money in it yet. That would be in the budget process, but this bill sets up the program to give up to $5,000 a year per student who is attending these programs, and the state dollars would be matched by could be matched by Voc rehabilitation dollars. So every dollar spent, contributed or invested in by the state would be matched by $3. Is that correct? Is it a 1 to 3 match?
3.7.
3.7. Thank you. So significant federal dollars could be brought in to pay for this program. We know that Representative Ingalls is working on a similar bill in the House. So you might recall the bill has passed the House a couple of times, but has never made it through the Senate. So the Senate is really where we know we need to have more pressure. And hopefully maybe with a change of committees and everything, maybe this will be moving forward. House File 5, it was filed by Representative Eddie Andrews, who's my legislator. He has a constituent, I think it might have been his campaign manager or staff, that has a child with who's been diagnosed with autism spectrum disorder. And so he filed a bill that would require insurers in the state to eliminate all of their caps on annual caps of 30, I think they're $36,000 now. And also caps on the number of visits that a person can have, and remove the age limit to right now our law only requires payment up to age 18. This would have removed that. So that bill has been filed. I believe the DD Council has registered in support of both of those. House File 13 is Representative Taylor Collins, who's from the Muscatine area. And he has proposed an automatic increase to Medicaid providers. So you wouldn't have to wait and beg each year the legislature to increase your reimbursement, but and it would be either tied to a regional inflation factor, or at most it would be 2.5% a year. So whichever is the lowest, the regional inflation factor or the 2.5%. And I think most Medicaid provider groups are in support of that. House Study Bill 10 is a study bill, so that means the committee has requested it, the HHS committee. And it allows schools to use athletic trainers instead of a school nurse, in lieu of a school nurse. So you wouldn't have to have a school nurse. You could have an athletic trainer on staff. School Nurses Association have all registered opposed. And of course, there's some concerns among families of kids that have significant health issues about the and like seizure disorders, having an athletic trainer who's untrained on the medical side to be addressing some of those needs. So I think that's something that we will all be watching and seeing if it moves forward. So those are the ones that were introduced. There were about 200 introduced this first week, but we're keeping them updated in the bill tracker. Haven't seen anything else that we really felt we needed to flag for you today. But there may be some others you're interested in our bill tracker. Questions or, oh, there's somebody that has our hand raised. Let's see who it is.
Dakota has his hand raised.
Hello, just a quick question. The increase in the Medicaid that we got, or that it says up there. So how is this going to, I guess, affect the federal level as far as that goes? Because I know they're talking Medicaid or Medicare cuts. It's so that's kind of got me curious. Like, is this gonna affect this, or do we know yet, or anything like that?
Really good question, Dakota. And that is why we're also going to have a Zoom, I can't remember what we're calling it, but a session on Medicaid, specifically the federal proposals that are out there, and the impact on the state, or potential impact. And we'll give that date out at the end here, but the increase here really doesn't do anything other than sustain the services we're already doing. It sustains some of the increases that were given to disability service providers, to make sure they can continue to provide services at the rates they were promised a few years ago. But it doesn't really do anything on the federal side. We are watching that really closely, because that will most definitely impact anything they do on the federal level with Medicaid will impact us. And some of those things are like block grants, summer cuts. Any of those could have a significant impact on the state. So that's a good question. I'm not sure that's, Carlin, do you have anything else to add to that?
I was just going to say that if this, as Amy said, this doesn't do anything currently, if it passes and gets included in the budget, and then there are federal cuts, then that means that they have to adhere to law and make these increases to providers. They're going to cut services in other places or make cuts in other places, and it could be in services. So yeah, there's just too many unknowns at this point. But good job, Dakota, for having your radar up and already on top of what things might be coming down.
Yeah, and when you look again at that chart with the amount of money going to education and HHS, there's really nowhere else if we get cuts federally to pull from. You're either pulling from the education system or you're pulling from courts. There's just not enough in that 7% slice to really do anything for us. So any kind of change at the federal level that reduces funding or gets rid of mandates for some services, it's going to be concerning. And the other concerning thing is we kind of know we're on hold on the waiver redesign because that's going to cost a lot of money, and we have not heard an update on that, but I'm pretty sure that that's not on schedule to happen this year. That's going to take some time. Oh yeah, good question. Any other questions before I move it over to Carlin to talk about what you specifically can do? Some of the tools we have, things coming up. Well, feel free to jump in if you have something coming up, but Carlin, I'll turn it over to you.
Thanks, Amy. Hopefully I'm getting rid of the frog in my throat again. Welcome, everyone. I'm Carlin Crow, the Public Policy Manager with the Iowa DD Council, and glad you joined us today for our first Capital Chat of 2025. It was a really busy week at the Capitol, even though it was mostly introductions and people getting back into their normal routines as far as what happens up there. But a lot of bills, as Amy said, were introduced, so we were having to keep track fast and furiously, and we'll continue to do that throughout the session, and try and keep you abreast on as many as possible through these chats. But I'll talk at the end about where else you can look up what to track. So these are some talking points that we came up with to help you know more about the bills, and then also be able to advocate on them, and or just educate other people about what's going on in disability policy in Iowa. So we hope and encourage you to advocate for these issues. And if you need additional information, again, we'll share some resources at the end, but always feel free to reach out to us. So we have 4 today, as Amy already reviewed them, and just a couple of talking point bullet points for each. One thing we'll point out too is that some of these talking points we're going to be reusing, recycling, or being very consistent in how we use our talking points in our capital chats and then in our bills of the week. So every week we'll have a bill of the week that we highlight in print for legislators and then for advocates. And so we will be very consistent with these talking points throughout. So also want to mention that your story and your experience with any of these issues is the most important thing that your legislator wants to hear about. So these are some ideas for what you can talk about, but if your experience is much closer to the issue and you have something very specific to talk about, all the better. The more specific you can be about how it would affect you, the better. So we'll go through them each one. As Amy mentioned, Senate File 14, Senator Taylor did not introduce this last year. It came from Representative Ingalls, and then Senator Taylor was assigned to it in the Senate and tried to move it through, and it got stalled. And so he introduced it himself this year in the Senate, which is a big deal. It means that he's really supporting it, and he's on the Education Committee, which we'll go through. So, and him being a college professor, I think helps with that. So he sees the importance of these programs and what they can do for students with intellectual and developmental disabilities. So a couple of talking points would be that this bill will help students with intellectual and developmental disabilities be able to go through college programs that they typically would not have access to because they're assigned just for them, and it helps them build job skills and independent living skills. The problem with these programs is that they're expensive, and there's not a lot of financial assistance available because they are, for one, not degree programs. And so that doesn't allow students and families to access some federal funds and student loans, particularly, to be able to put students through these programs. So that's why the scholarship program is important to offset those costs. And the amount is, still something that's going to be under consideration. Not the amount per scholarship, but the amount total. And so, how we're talking about this might change when it comes to budget time. So next we'll move on to the insurance coverage for autism spectrum disorder by Representative Andrews. And as Amy said, his campaign manager has a son with autism. And so she had been talking to Representative Andrews about how much it was costing them to put their son through ABA services, and that their insurance was going to max out. And so, luckily they have private insurance that covered part of it, but there was a limit. And so Representative Andrews took that to heart. He has a special place in his heart for people with autism. He just told me that yesterday. So I'm sharing that with you today. And some things that this would do is talking point number one, they're require private insurance to cover ABA without an age limit or without a benefit limit. So it's not completely unlimited, but it is those other limits that were there are taken out. And then the other thing that this bill could help with, because there is a shortage of service providers in the state who provide ABA services, and they typically don't even go up to age 18, or many of them don't, and the ones that do are few and far between, hard to access. So hopefully this could help more people with autism get the treatment they need, and possibly help more places provide treatment in Iowa, or help more providers come to the state or start practicing here. So yeah, that's it's a pretty short and simple bill, and it's a good start for helping be able to have more services in the state.
And I think, Carlin, one thing that you said about bringing more workforce to the state, I think is important on that one, because we have heard from a couple families that say the current providers of these services, not many serve people over the age of 18, even if you could privately pay. So we're hoping that if insurance covers it and you bring more people, perhaps that means that some of the providers will begin serving and providing those services for the older, I don't want to say older adults, because 19's not older, but the adults in the system.
Great. If we can move on to the next slide. I think it's the Collins bill. Yes. So the automatic rate increases for Medicaid. Oh,
That just, sorry, hit a button.
really. Sorry.
Oops.
As Dakota pointed out, this this could be a game changer a little bit for Medicaid. Because if this is required, if 2.5% or inflation rate increases are required for reimbursement rates annually, then it could mean cuts in other places. We hope that doesn't happen. We hope that the budget will make up for it, and it's something that is been in our public policy priorities for several years, and so this is a good bill. And Amy, their slides still aren't up. Are you
They're not?
clicking?
Huh. You don't see anything?
Nope.
Okay, hold on.
Just a
Sorry.
smiley face.
No, I'm sometimes when I click on the PowerPoint, I lose the picture of you guys. So let me try.
Amy, I
sharing
can share
again.
if you want me to.
No, I got it.
I know how that happens.
Yeah.
It's hard to do both.
Okay. Now?
Yes. Can you click?
Okay.
There we go. So, yes, right now there's not an automatic increase, and this would make providers very happy if there was an automatic increase, and all of us who advocate that for increases every year, it would make it much more common sense to keep it up with inflation. And the increase is, just 2.5%. So depending upon inflation rates and, costs of that providers expenses, that they may need to cover, it may not cover it. So there might, need to ask for more increases on top of that. So that is something that could happen. And then House Study Bill 10 that Amy mentioned regarding school nurses. There was a movement a couple years ago to eliminate school nurses or combine them between schools. And a lot of parents of kids with complex healthcare needs or kids that need some personal care to use the bathroom during the day, things like that, came out in strong opposition to that. School nurses, research shows that having a nurse in every school keeps kids in school. And so one of the talking points is that some students might not be able to come to school if there's not a school nurse there to help them. And we certainly don't want that to be happening for kids with disabilities. Yeah, you can move on to that. Tools to help your advocacy. All of this information is available on our website. One of the big resources that we have available that comes out in print, and Amy is still working on final edits, is our guide to the legislature. The reason it's not printed yet is because there's still a couple of seats that are up for special election, one because of lieutenant governor. So it's online right now on our website in draft form. And so if you start reading it and see a typo in it, just know that it's still in draft form and we're in the background still proofing it. And you can send it to us if you want, because all the proofers, the better. And we also added Congress this year. So your members of Congress are profiled along with how bills move through Congress. So to give you some more resources. And then for tracking all the bills that we are also tracking is our bill tracker on our website. So you can look there at the description for each bill, just like we talked about today, and then click and go to the legislative website if you want to look at the bill's language. If you're really nerdy, like the rest of us, and want to look at the bill's language, please, that's an easy way to do it. And then if you want to take action, remember your bill and number and click over to the Take Action Center, and you can write a letter to your legislator, an email, quick and easy right there, using some of the language that we may have provided by help, or may hopefully helped by providing today. Bills of the week, we're producing every week one bill we're highlighting, and those will be posted. You had a preview of that today with the autism bill, House File 5. On the reverse side of bills of the week will be talking points for advocates. And then we have a calendar online that shows all of the legislators' forums on the weekends or during the week when they're home, as well as our events. And moving on to events, Amy mentioned our Medicaid discussion. That will be on February 7th. Registration will open up for that this week. It's on Zoom. It's called What's at Stake and How to Advocate. And we'll talk about what's going on at the federal level that we know about, what's being discussed, and how that could affect Iowa and our budget here. Our legislative reception, which is not a day on the Hill, it's a legislative reception, is January 29th. And for self-advocates, the Allies and Advocacy is having a reception at the State Historical Building. So, and the big discussion will be about employment. So you're invited to that. Registration is open for that also. And then our capital chats are every other week. And we're right at 30 minutes. We almost did it. But please, any questions, feel free to raise your hand and put them in the chat. I see there's some things in the chat.
I'm gonna stop sharing so I can see the chat. But the slides will be up on our website as well as sent out with the video of this afterwards, and on the Iowa DD Council YouTube. It's linked on the YouTube videos as well. So you can, if you didn't get a chance to see anything. Fran asked if we have any data on the number of persons in Iowa impacted with autism. I have the Autism Council said about 2.7% is the number they're going with. 53,000 something adults with autism. I can't remember, 53,600, something like that.
And I was just looking at school enrollment, and 1% of students on an IEP or 504 in Iowa are someone with autism. So I know that one because I just read it right before our chat today.
Yes, we since we are covering that as our first bill of the week, which should be up next week. We're still working on the formatting of it right now, but in the talking points and facts that we have some of that information. So check the website under our bills of the week next week, and hopefully up by Tuesday. Carlin's a state employee, so she has the day off on Monday. So I'm not sure if it'll get up until Tuesday.
Hopefully you'll be able to take that day off.
I'll be working. All right, well, everybody, I think I'm gonna put my email in the chat. I know you probably have Carlin's, but if you have questions after these, you can save them till 2 weeks, or you can just email us, let us know how we can help. Thanks, everyone.
Thanks, everyone. See you next time.